Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's happening with the opioid crisis in Maryland? Find out more right now. My guest this evening is Dr. Yngvild Olsen, a practicing physician and chairman of the State Medical Society Committee on Opioid Addiction. Yngvild, welcome to Housecall.
Thank you so much for having me. It's great to be here.
So briefly tell our viewers about your professional background.
So I trained as a primary care general internist many years ago, but had become interested in addiction medicine as a medical student, and then continued as a resident. And really, so for the past 20 plus years, I have been dedicating my career to helping take care of patients who have substance use disorders, and specifically opiate use disorder, and teaching, speaking, writing. In fact, I am co-author of a book called The Opioid Epidemic, What Everyone Needs to Know. And I just have a passion for this.
How interesting. So briefly, tell our viewers about your role, not just as a practicing physician with an interest in or specialty in addiction medicine, but specifically your role as chairman of the State Medical Society, also known as MedChi, the Opioid Committee.
So the Opioid Committee was actually started in 2017 by Dr. Gary Pushkin, who was then the president of the Medical Society. And he started it really, understanding the gravity of the opioid crisis, and realizing that physicians really had not, to date, and we're still, not getting sufficient training in opioid prescribing, substance use, addiction. And so he really wanted to actually have a task force that kind of pulled together various different parts of the medical society to help provide that training and those educational resources to physicians. So he was really able to kind of elevate the issue to the House of Delegates at MedChi. He was able to convene a number of different partners, both from within the society as well as outside. So, for example, the Maryland Patient Safety Center, the Maryland Department of Health, the DEA even, to really kind of try and problem solve some of the issues that physicians face and that we as a state are facing. It has then evolved into kind of a standing committee. And recently, Dr. Pushkin asked me to take over the helm as the chair.
Very nice. Now, there is, of course, a parallel committee on a state level with the state government, the Opioid Operational Command Center. Tell us about that command center and how it interfaces with the State Medical Society Committee.
So, right, the Opioid Operational Command Center, it sits within the governor's office. And so it was Governor Hogan, several years ago, when he really then proclaimed that the opioid crisis, the opioid epidemic is an emergency in Maryland, much as it is across the rest of the country. And there were efforts, he really wanted, I think at the time, to pull together from within the state, across the state agencies, the focus, to really kind of elevate and bring a focus to this crisis. And so we created the Opioid Operational Command Center. MedChi and the Opioid Committee, we have a seat on that task force in that center, along with a whole host of other folks from the Maryland Department of Health, both the Behavioral Health Administration that is part of that, as well as public health. There are representatives from the Department of Human Resources, the Governor's Office of Crime Control and Prevention, kind of a whole host of governmental entities, as well as then advocacy organizations, provider organizations. So it really is kind of a cross uh, of a spectrum of individuals who are involved in this space and who need to be involved so that there are decisions that can be made around how the state, when it receives grant funding from the federal government, how that can get spent, how funding that comes from the state can also kind of what priorities there are. That OOCC puts out a strategic plan every year, every other year. And so MedChi and the Opioid Committee has a voice in how that strategic plan, what it looks like, what the resources. That OOCC has done an amazing job at pulling together in a matrix, really, all the types of different resources related to treatment and harm reduction and prevention and other types of resources that can be found on their website.
Does the MedChi committee and or the state committee deal with addictions beyond opioids?
That's an excellent question. I think what we have learned, not only in the country, but we've also seen it here in Maryland, is that when we talk about this crisis, it really has had several different waves over the past 20 years or so that we've been living with this. And it started out with prescription opioids and overprescribing of prescription opioids. And it then evolved into that heroin was really kind of driving the overdose deaths. Now we have illicitly manufactured fentanyl. But what we're seeing is that there's a rise in the last couple of years of overdoses, fatalities related to cocaine and methamphetamine and other kind of psychostimulants that get prescribed. It's really now become a polysubstance use crisis, including alcohol as well. And so, I think there is a recognition on the part of not only the state, but also within MedChi that we do need to look broader than simply opioids.
Colleagues, as physicians, we both recognize there is a so-called addictive personality, and sometimes you will your success therapeutically may be shifting somebody from one addiction to another, and it's striking because during the stress of the pandemic, we've all seen patients who, if they're not abusing alcohol or abusing opioids, they may be abusing food, for example. And I learned a new term last night when I watched the NBC News that a hot new topic among psychiatrists is internet addiction, where individuals are so cooped up in their homes, they are literally addicted to the internet and going from one link to the other without any self-control.
Yeah, I think so. If you look at kind of how we as physicians and other clinicians make the diagnosis of a substance use disorder, we do so according to criteria that are laid out in what's called the Diagnostic and Statistical Manual, the fifth edition from the American Psychiatric Association. And that has a chapter on substance related and other addictive illnesses. And the one kind of non-substance related addiction that they have set out criteria for in a diagnosis is for gambling. But you're absolutely right that as we learn more, as there is more and more research, even the American Psychiatric Association has stated in that manual that on further revisions, they will look at other types of addictive conditions, such as sex addiction or gaming addiction or internet addiction. I think we all kind of are hearing not just about kids and adolescents, but also adults whose lives and function, because that's really kind of when we think about addiction and when we think about substance use disorders and substance use, it really is the functionality and the negative consequences that people then experience as a result of either that substance use or those behaviors that kind of then meet the criteria for kind of a diagnosis of addiction or a substance use disorder.
We have 2 minutes before we go to our break. Very briefly, there's been conflicting data, to my knowledge, about the effects of the COVID-19 pandemic and the opioid crisis. Share with our viewers briefly what happened with emergency room visits and opioid-related intoxication fatalities during the past year.
Yeah, so, I think the past year has been extremely stressful for all of us, but certainly for people who have an opioid use disorder or are at risk for them. We have seen that, the CDC put out some new data that the year from June of 2019 through May of 2020, the country experienced over 80,000, 81,000 overdose deaths. That was the highest in the 20 years that we've been dealing with this. Maryland also saw a significant increase in opioid-related overdose deaths after about 16%, after actually having seen a slight decline between 2018 and 2019. We know that people who have been isolated, and isolation is a part of addiction, unfortunately, that stress is a risk factor for substance use. What happened in terms of the emergency departments, though, unfortunately, is that there was a dip actually initially in the first couple of quarters, because I think people were afraid of what was happening in emergency rooms, in hospitals, that COVID really has been such a tremendous stressor for individuals, in keeping them from accessing treatment and keeping them from accessing care for other health conditions, including trying to get to the emergency room.
Hold that thought. We're going to pause briefly for a public service announcement. More with our guest tonight, Dr. Yngvild Olsen, an authority on opioid addiction from representing the State Medical Society. We'll be right back. Back with my guest, Dr. Yngvild Olsen, a physician specializing in addiction medicine and chairman of the State Medical Society Opioid Addiction Committee. Yngvild, when we paused for the break, we were talking about the impact of the COVID-19 pandemic and drug overdoses nationally, and in particular in the state of Maryland. One thing that was interesting was apparently there was some variation in the statistics looking at fentanyl versus heroin versus opioids. Share with our viewers what those disparities included.
Yeah, so, I think Maryland, and particularly Baltimore City, which is where I practice, but in Montgomery County and kind of throughout Maryland, heroin has always been kind of the opioid, the illicit opioid that people have been talking about. What's really dramatic, I think, in the last several years, particularly since around 2017, is the introduction of illicitly manufactured fentanyl. And that is, I'm sure your viewers have heard of it because it has been so much in the news. It is a substance that is 50 to 100 times more potent than heroin. And so just a little bit of it can be really dramatically fatal. Even for people who have very, very high tolerances and have been using heroin for decades. So, what I mentioned at the beginning that, back in the 2000s, late 1990s, 2000s, there was a big push for physicians like myself, and you may remember this, that to start prescribing opioids and high doses of opioids like OxyContin, oxycodone for the treatment of pain, any kind of chronic pain, acute pain, cancer pain, you name it. We did that in an environment where there was very little training around addiction, the consequences, the potential consequences. And what we saw was that there was a significant increase in overdose deaths related to prescription opioids. What you see kind of during COVID, because that was a driver for so much action, so much policy setting. And this in Maryland, for example, between 2017 and 2019, the state experienced a 22% reduction in the prescribing of opioids. So we actually had experienced a decrease in the number of people who were dying from prescription opioids. During COVID, we have actually now seen that number reverse, and it's gone up a little bit. It is nowhere near where the overdoses are related to fentanyl and that illicitly manufactured fentanyl, which is still the driving force in Maryland and in the country. But that little, kind of uptick in the prescription opioid-related overdose deaths is quite concerning. At the same time, we've seen heroin virtually disappear and being replaced by this illicitly manufactured fentanyl that is cheaper to manufacture, it's faster to manufacture, and because it's so potent, it only takes a little bit. So from a street dealer perspective, it is much more profitable, but people are losing their lives over it.
How does Montgomery County compare to the rest of the state and then the rest of the country in terms of these opioid overdoses and fatalities?
Yeah. So, if we looked at kind of just sheer numbers, Montgomery County, kind of is among the of the larger counties in Maryland. It's kind of in the middle. Baltimore City, Baltimore County have been the hardest hit over the years, but certainly Prince George's County and certainly Montgomery County has also had its losses, tragic losses of individuals who have lost their lives from this. During COVID, what we have seen is that much of Maryland has had an increase, about almost between 18 and 19% of an uptick in overdose-related deaths. Montgomery County, so that's kind of the state average. Montgomery County has had about 25%. Anne Arundel County, 22%. And Prince George's County and some of the other counties, Cecil County, Howard County, have actually seen increases of over 50%. So, I think we really have to kind of think about what's happened during COVID, the isolation, the just fear, that stress that can be such a trigger for people. And now figure out, as we're kind of coming out of COVID, how are we then going to really help people not only preserve their lives, but then ultimately improve them?
As you know, locally and nationally, one of the growing trends is some form of legalization of marijuana, either as medicinal marijuana or in small quantities to be used in a social setting. Given your background in addiction medicine and given your position as chairman of the MedChi committee, do you view this trend of legalization of marijuana as a potential useful ally to substitute a dangerous drug for one that is perhaps a bit safer? Or do you view this legalization of marijuana in a negative viewpoint, considering that it may be a so-called gateway drug, introducing people that are non-users into potentially worse and worse drug abuse?
So that is a complicated question, but a really important one, I think. So I guess that the way I kind of look at it is this. Alcohol is legal, and we have a very, some regulations around alcohol. We also know that there are people who use alcohol and have no problem. However, we also know that there are over 80,000 people a year or so that die from an alcohol-related condition. And alcohol, sometimes it can take time for people to develop those kind of fatal conditions, but certainly there are a number of Americans, a number of significant percentage of individuals who will get into trouble with alcohol and really develop an alcohol use disorder. I worry about the same thing with cannabis, with marijuana, because we certainly know that there are individuals who develop a cannabis use disorder in which their function, their daily lives, their work gets impacted, their education gets impacted, their family gets impacted. They can't really, kind of do the activities that they really need to do in order to have a family, function, be employed, etc. I especially worry about cannabis, like I do with alcohol, when we're talking about. So I guess that the way I kind of look at it is this: alcohol is legal, and we have a very, some regulations around alcohol. We also know that there are people who use alcohol and have no problem. However, we also know that there are over 80,000 people a year or so that die from an alcohol-related condition. And alcohol, sometimes it can take time for people to develop those kind of fatal conditions, but certainly there are a number of Americans, a number of significant percentage of individuals who will get into trouble with alcohol and really develop an alcohol use disorder. I worry about the same thing with cannabis, with marijuana, because we certainly know that there are individuals who develop a cannabis use disorder in which their function, their daily lives, their work gets impacted, their education gets impacted, their family gets impacted. They can't really, kind of do the activities that they really need to do in order to have a family, function, be employed, etc. I especially worry about cannabis, like I do with alcohol, when we're talking about teenagers and adolescents. And I think part of the problem is that we don't have a good system yet to really be able to understand and figure out how we can make sure that we have the preventive systems in place, the treatment systems in place, the real education and understanding of what a cannabis use disorder, how to identify that. And we need more physicians like you and I to really kind of embrace the fact that addiction is a brain disease. Cannabis use disorder needs to be identified and screened for and intervened with, particularly when it comes to adolescents, because at that point, their brains are still developing. So we know that substance use, any kind of substance use, whether it's alcohol or nicotine or cannabis or heroin, anything, that when people start at an early age in adolescence, that they are much higher risk for developing an addiction in adulthood. We know that family history is a risk factor. And so really talking about kind of, the family history of a substance use disorder, and it doesn't have to be the cannabis and, kind of marijuana goes parent to child. It could be alcohol, it could be nicotine, it could be, kind of anything else. So, I think that before we, really kind of, or as we are moving into these various different policy decisions, we really need to understand what the potential consequences are, and we need to actually then be prepared to deal with those, and to have the systems in place where we can really minimize any potential harm. I will say the last thing I would say about cannabis is that it's hard because there's also an equity component to this. We know that the mass incarceration of Black individuals, Black men in particular, has been driven in large part by marijuana policies. And so we're thinking about kind of, how to make sure that we actually not incarcerate individuals who have a health condition like the addiction We also really need to think about kind of the decriminalization, and how we are approaching people who have a substance use disorder, whether it's to marijuana or alcohol or fentanyl.
You raised an interesting point, and that is, do you think the trend over time has been to focus more on preventative measures, rehabilitation, and reduce the criminalization?
I absolutely think so. I think there's a recognition, and there has been a recognition, partly driven by the opioid crisis, that addiction is a chronic brain disease. Substance use disorders are clinical diagnoses for which there is prevention, there are treatments, there are harm reduction elements and components that we can put into place that save people's lives, that reduce the risk of communicable disease transmission. So, for example, like hepatitis C and HIV, and that they are evidence-based. They're proven to really be very effective. And we know that there are millions and millions of Americans, including in Maryland, who live every day in recovery and are living very productive, healthy lives, caring for their families, working, celebrating kind of life. And so I think that, part of what we're really talking about is making sure that we are looking at addiction as the disease that it is. We have a lot of scientific understanding that underlies that. We need more. And that we know that there are treatments that are effective for opiate use disorder, alcohol, nicotine. We don't have great medications for cocaine or methamphetamine or marijuana, but a lot of research is still going on. So I think there is hope.
Well, Dr. Olsen, thank you for a superb interview. If our viewers have any questions, how can they reach you?
So for one, they can look at the book I'm the co-author for. It's called The Opioid Epidemic, What Everyone Needs to Know. It's by Oxford Press. And it's a series of 177 questions, frequently asked questions, about opiate use disorder, everything from policy to prevention, harm reduction, treatments, what family members can need to think about, what individuals need to think about. And they can also always find me through MedChi and through the MedChi website.
Thank you so much. My thanks to Dr. Olsen for a superb interview. My thanks to the team for their excellent assistance with this program. And my thanks to you, the viewer, for making Housecall the success it has become. With this program, we celebrate our 8th year on the air. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, I will be interviewing George McFarland, director of the Montgomery County African American Health Initiative, and we'll be discussing health disparities for the African American community, a very important topic. See you then next time for another edition of Housecall. Good evening.
What do you think you're doing, Kevin?
Was just gonna drive home.
There are several warning signs present that you shouldn't be driving.
Like hearing voices?
Like your text-to-emoji ratio?
Oh man, the selfies. Selfie, nailed it.
We all have warning signs that let us know that we're probably not okay to drive. Mine is pretending to be your subconscious.
Craig, come on man, let's split a ride home.